How often do I need STI tests after a new partner? When you start a new sexual relationship, it's natural to wonder about testing. Protecting your health and your partner's is key, so knowing when and how often to get tested is important. The timing depends on your individual risk factors, sexual practices, and the type of infections involved. Most health authorities recommend that if you are sexually active with a new partner, you should get tested as soon as possible after beginning sexual activity. This initial test helps establish a baseline and catch any infections early. But keep in mind that some infections have a window period, which is the time between exposure and when a test can reliably detect the infection. For example, nucleic acid amplification tests for chlamydia and gonorrhea can usually detect infection within 1 to 2 weeks after exposure. If your initial test is negative but you had unprotected sex or high-risk behaviors, follow-up testing is recommended 3 months after treatment or potential exposure to catch any possible reinfection. For women under 25, annual screening for chlamydia and gonorrhea is recommended regardless of perceived risk, because these are the most common bacterial STIs. Women over 25 should consider testing annually if they have new or multiple partners, or if their partner has an STI. Men who have sex with men should get tested at least once a year for syphilis, chlamydia, and gonorrhea at all sites of exposure, including the rectum and throat. If they have multiple partners or engage in higher risk activities, testing every 3 to 6 months is advised. Pregnant individuals should be tested early in pregnancy and again during the 3rd trimester if risk factors are present, since untreated infections can affect pregnancy outcomes. Different infections have different window periods. For HIV, testing can detect infection from 18 to 45 days after exposure, depending on the test used. Retesting after initial negative results is important if there was a recent potential exposure. Syphilis testing depends on symptoms and exposure history. If your partner has syphilis, testing and treatment are necessary. A comprehensive STI screening after starting with a new partner usually includes tests for chlamydia, gonorrhea, syphilis, HIV, and hepatitis B and C if risk factors exist. If you have genital symptoms or your partner has herpes, testing for herpes simplex virus type 2 may also be recommended. If you test positive for an STI, notifying your partners is crucial so they can be tested and treated. This helps prevent reinfection and stops the spread within your sexual network. Many clinics offer expedited partner therapy, which allows your healthcare provider to give you medication or prescriptions to pass on to your partners without them needing a separate visit. The best approach is to have an open conversation with your healthcare provider about your sexual history and risks. They can help you develop a testing schedule tailored to your needs. If you're uncomfortable discussing this with your regular doctor, many clinics provide confidential, low-cost, or free testing options. Before stopping barrier protections like condoms, consider testing together with your partner. This shows mutual commitment to health and provides a clear baseline. After both of you receive negative results and agree on monogamy, you can discuss adjusting your protection methods based on your relationship. Remember, regular testing is part of responsible sexual health. Whether it's annually or more often depending on your activity, staying informed and proactive helps keep you and your partner safe. Always seek personalized advice from healthcare professionals to ensure your testing routine fits your specific situation.